we have our own Mark Stryker. Mark is the Chief Business Development Officer for GuideWell Connect.
Hi, everyone.
Mark, welcome to the interview.
Thank you. Always good to see you. Kate.
Outstanding.
Folks, Kate is my podcasting partner in crime back in the
reference.
GuideWell world.
That's right. You'll find a few interviews up on iTunes,
That's right.
GuideWell's iTunes channel. So good call there, Mark. Okay. Mark, so you come with a very unique perspective. You have been in the innovation field. You've been on the marketing side. You've been on the sales side. You know this industry really through and through. In your opinion, what area of health and medicine most needs to be disrupted in order for real transformation to occur?
So that's a really good question. And at the end of the day, I think the reality is it's all going to be disrupted. And GuideWell Connect is always focused on the consumer. And in my mind, the ultimate disruptor is actually the consumer.
Right.
So that consumer and the need to work with that consumer is going to go across the entire value chain of the health verticals, everything. From the payer space to the provider space, everything is going to be disrupted by that consumer getting more activated in their own pursuit of health. And so it's going to be a very interesting time. And at the end of the day, I think it goes everywhere.
Right. And I think that you really you reflect a lot of conversations that we've had here about keeping the human side of medicine front and center. So here, as we sit in the innovation lab at Exponential Medicine, we have technology on display, but I think that, as you mentioned, it's keeping the person at the core of care delivery, at that new medical innovation. That's really what's going to make it successful ultimately.
Yep, that's exactly right. And that is the big piece, is that understanding of what the consumer wants. And the real thing is it's going to be an unveiling of the consumer figuring out what they want.
Right. Well, Mark, again, you've had a couple days here now at Exponential Medicine. I was wondering, what one thing do you think will most significantly alter the way the average person consumes healthcare?
So, the way that they consume healthcare, I think, is going to be really influenced by where the delivery points evolve to. So, for instance, the way that they receive care, that all of us, we consumers, receive care over the next 5 years is going to radically change, whether it's through telemedicine or through pop-up deliveries or whatever those things that we haven't even thought of yet. There's going to be a radical change in how care is delivered, systemically and person to person. And so the ability of that provider to know their patient one-to-one, I think of it as kind of a return to the old neighborhood doctor kind of mentality, or at least potentially, where that doctor is able, through data, through understanding, and through really great tools, to get to know that patient, that consumer, at a very personal level, just the way it used to be.
Right. Well, Mark, I think of my next question, really, you made that reference to some podcasts we had recorded where you talk about using data to help personalize the message, the brand, whatever it might be that we're talking to our consumers about. How do you think that big data is really going to evolve the patient experience?
So that's a really good one. So at the end of the day, there was a really interesting quote from Dr. Sawyer from the University of California here earlier today, and it really was around big data, and that context is the key to providing actionable data. And so that's going to be the big thing, I think. When you look at the vast reams of data, and more collected every day and from different sources, the key is going to be the context in which it is interpreted to provide care and provide insights and understandings around both the services that are delivered and the folks that consume them. So there is going to be a real change, I think, in terms of how we understand what valuable data is and the context that we put it in for the consumer, and the context that the consumer puts it in and allows us to put it in order to do great things with it and great work with it.
Well, I think great things are actually really underway already here at Exponential Medicine. We've had many speakers on, Mark, who were talking about building frictionless big data, repositories that, again, as you said, really could totally change the way care is delivered and the outcomes that we expect to see. So I think that you've really keyed into some really critical themes here.
Yeah, and it's really important for us. We have mountains of consumer data in the GuideWell Connect world, and it's really key for us to continue to push the understanding of that consumer. To test our own limits in a lot of ways, to say, do we really understand? Are the things that we knew yesterday still as powerful and valuable in providing great results and great interactions and engagement with that consumer in the future. Because as all of that changes, it will change just as radically for all of us.
Absolutely, and again, I think that you repeat something that you've spoken to before a couple times, and that iteration is key. You always have to make sure that you're reflecting what the consumer might need, not just today, but tomorrow. So Mark, you were a wonderful guest here at the Guidewell Insights Lounge. I want to thank you for joining us and hope that you enjoyed the next couple days of Exponential Medicine.
Pleasure, it's great, it's an amazing event.
All right, my name is Kate Warnock. Thank you so much for joining us here live at the Guidewell Insights Lounge. We'll be up next with an interview soon.